Well, we'll try it again. I recorded this once, and maybe technology didn't get it right. It's Dr. Baumholtz, and this Friday episode of whatever we want to call this goes something like this. Finished surgery today, and I was on Instagram, and I saw this story about someone I know who reportedly had done her research, and this led her to a surgeon in another state. And she was extolling this particular person's virtues and his experiences and all the reasons why you might consider this person compared to surgeons in this state and maybe a couple others. And one of the things that was mentioned was how much cheaper this person was. Okay? And that's as far as I'll go in terms of identifying this story one way or the other. Because I did a little bit of research. The surgeon is actually not a plastic surgeon, certainly not board certified. Calls himself a cosmetic surgeon. Has a pretty colorful background, which doesn't take much on Google to read about and become a little concerned, right? And so this led me to think about when people are choosing based on cost alone, are they really thinking through the decision or a decision that can dramatically impact their health? Doesn't mean you can't get something done cheap, and doesn't mean you can't get it through it safely, but more often than not, there's a reason that those of us who are board certified in plastic surgery spend years and years and years training and perfecting the work that we do, if it ever is perfected, but improving the work that we do for the purpose of keeping patients safe, bringing the latest techniques to bear, tried and true techniques, and really, really, really trying to manage the expectations and realistic expectations of the patients that come to us. So again, I've mentioned this before. Please understand, cosmetic surgeons are not plastic surgeons. A plastic surgeon can do what's called cosmetic or aesthetic surgery, but a cosmetic surgeon, someone who's maybe done 1 year or less of training and then decides to call themselves a cosmetic surgeon, is not a plastic surgeon. So when you ask someone if they're board certified in what? And then what experience do you have with this particular procedure or condition? And then I think a really important question is, tell me about the complications. And tell me how you handle the complications. The only surgeons who don't have complications lie or they don't do surgery. That's a fact. I've said that at local meetings, at national meetings. I'm saying it here. The only surgeries that don't have risks are the ones you don't do, right? Unless it's a cardiac thing or cancer thing and you have to do it. That's a different story. Okay, we're talking about elective surgery. So let's assume you're choosing to have a procedure which could have some risk by a surgeon that could have some complication. Go where there's all the safety nets. Here we exclusively use board certified anesthesiologists. This is not a dig on nurse anesthetists, but it's a physician that's entire job is to keep you safe. We're going to go to a real operating room in a real hospital or a real surgery center associated with that hospital. We're going to put as many safety nets underneath you as possible. Yes, more often than not, it costs more, but that cost translates to an increase in your safety. And if that's something that you're comfortable taking chances with, that's okay. That is your choice. This is not how we're going to do things. Now, I know that many of you have questions about cost and pricing and procedures and how many procedures it takes to be comfortable, et cetera, and I'm happy to answer any of them. So submit your questions. Let me know what you'd like to know more about. This is my Friday, it's going to say 2-second take, but we're almost at 4 minutes. And I hope it gets you thinking about when you're out there and you're ready for a cosmetic or aesthetic procedure, and you go to select that person that you're going to trust with your health. Choose wisely, choose carefully. If we can help in any way, please call us. It's Dr. Baumholtz. Have a great weekend.